Here's your kneecap here.
Right.
Here's the...
Yeah, I was curious if it's...
Stabilizing it, and then over the next 6 to 12 weeks or so, yeah.
I know.
I don't remember a lot of it. Woke up in shock trauma here in University of Maryland. Yeah, I am a recovering addict, and I really didn't want to take any opiates because fear of, just in case, you know, not that I'm not strong enough to stop, I believe, but didn't want to take the chance of dependency again. And it was to a point back in 2011 where I was ready to lose, my wife was going to leave me, I was going to lose my job at 23 years. So I just had to evaluate what was more important.
Burning pain?
Not a burning pain, no, it's more of a pressure, sharp, something like that.
Well, the sutures coming out will definitely help. Especially overnight to take the medication. You know, even some of the... Technically it doesn't mask pain, actually we do the reverse in patients.
They did a nerve block on the femur, and it totally made everything completely numb. There was no pain at all.
Right. Perfect. Right. Perfect. Which is the main blood vessel that goes into the arm. Okay.
So before you had ultrasound,
As long as you can block them and provide them with good pain relief initially for the first 24 to 48 hours after surgery, the pain that comes back after that isn't necessarily as hard and as strong. And it allows them to sort of titrate and get more comfortable with the pain medications that is prescribed. Additionally, it gives them a psychological advantage that helps them recognize that they don't necessarily need to be in pain or are going to suffer significant pain, and that allows them also to adjust. You got here early.
Yeah.
5 o'clock.
They gave me wife's last.
They factor on pretty significantly. There's no doubt that our opioid use has been down. How significant the reduction has been, it's hard to say. Every patient's a little bit different. Also, patients sometimes have injuries that are unrelated to the nerve blocks area that the nerve block covers, but there's no doubt that there has been a significant reduction in opioid use in patients who get nerve block, single shots or catheters. Here's going to be our needle, local anesthetic. I'm going to aim this a little bit towards the arm. Now we're done.
For real?
For real.
Get out.
Yeah. He's not going to inject their own types of medicines through here. Probably the key is not necessarily the relapse mode that we're concerned about. I think what our biggest issue with opioid management is that we prescribe too much for too long.
so what are you giving now?
This is ropivacaine. Should have a red cap, Matt. Of course, 70%. The goal would be to dramatically reduce the amount of opioids they get in the hospital, in the recovery period, and to try and give them other adjunctive agents that will help them manage their pain for the next few weeks or however long it takes to recover, and avoid opioids almost entirely.
Are you going to need any pain refills today?
I'd like something, but I'd like, I don't know, something, I don't know.
Okay. The work note is, he says, oh, I need to see you again in 6 weeks.
Still blank for what happened.
Really?
As far as this procedure, I think this is something that everybody should do. Anybody, I mean, even people that aren't addicts, because it's so easy anymore to become addicted to that stuff, that this is a godsend, I believe.
take the medication you get.
Okay. Do you have a list of those medications with you?
I do in
In the
the
room?
packet in the room, yes, ma'am.
Perfect.